heroin addiction. Look at the Silverio family of Stockton, California. Cristobal Silverio, the father, came along with his wife Felipa and 3 children, aged 19, 12, and 8, in the year 1997 from Mexico. At that time, Felipa was the perhaps menopausal mother of the bride, the 19-year-old Lourdes, but Felipa gave birth to a new daughter the moment she arrived on American soil, an anchor baby named Flor, who was premature, spent 3 months in the neonatal incubator at San Joaquin Hospital, and cost the hospital at least $300,000. Lourdes, the 19-year-old, and her husband made their own anchor baby named Esmeralda, but Grandma Felipa, not to be outdone, created a second anchor baby, Christian. Now, Flor and Christian exemplify the fact that to an illegal alien, a sick anchor baby is superior to a well anchor baby. Flor gets over $650 per month because she has asthma, but well baby Christian gets only $319. However, Mama and Papa are fruit pickers and make $18,000 per year, but the anchor babies, for being anchorers, make $12,000 per year. So the family income is a very comfortable, relatively speaking, $30,000. Now, I drive a 4-wheel drive truck, and my mechanic employs an illegal alien assistant mechanic who came to me when I came to get my truck. The governor took my kids' shadows. And what did he mean? It turns out that the mechanic's assistant has 5 children. 2 have borderline autism, 2 have attention deficit hyperactivity disorder, and 1 has oppositional defiant disorder. All 5 take Ritalin and other psychotropic drugs provided by the state, but the borderline autism children each have had a shadow, a daily attendant who came with them and attended them at school from morning till afternoon at $30,000 per year per child. And the assistant mechanic and his illegal alien wife were able to have weekly respite care babysitters so that they could have dinner out once a week. The last problem we must consider is that of the contagious diseases that the illegal aliens are bringing in. Many of these we had already vanquished long ago because of our excellent medicine, our hygiene, and our sanitation, and some we had almost never seen here. In my medical school, we used to consider these diseases in what we call tropical medicine. These were the third world poverty diseases, almost never seen here in America. The first, multiple drug resistant tuberculosis, that is generally referred to as a time bomb. Tuberculosis had essentially disappeared from America thanks to such drugs as isoniazid and rifampin, and the old tuberculosis could be cured in about 6 months with 4 drugs, and it cost about $2,000 per patient. But the new multiple drug resistant tuberculosis resists at least 2 major tuberculosis drugs. The disease is 60% fatal. It takes about 24 months to cure, if it is curable, and it costs $250,000 to $1.2 million per patient. According to the Centers for Disease Control in the year 2005, that studied 38,000 cases in California, we have in the state of California multiple drug resistant tuberculosis in 38 out of our total 61 health jurisdictions. Most of the patients, 84% of those who have MDR-TB, come from Mexico and the Philippines. Contemplate Chagas disease. That was one that we used to call tropical. It has a disgusting nickname of kissing bug disease in honor of the protozoans, or the little bug's favorite method of inflicting infection by biting the lips and the mouth. In Latin America, 18 million people are infected with Chagas disease, and of these about 50,000 die every year. There is no effective cure. Chagas is infiltrating America's blood supply, even organ transplants. In 2001, 2 people died of Chagas-infected organ transplants. Many of us had tried as early as 1998 to get the FDA to create a blood supply test to be sure that our blood banks are not giving blood that is already infected with Chagas. But though we were promised that there would be such a test for the blood supply by 2005, we are still waiting. What Chagas does is to infiltrate some internal organs such as the heart or the intestines, which then enlarges, weakens, and in the course of about 10 or 20 years, explodes. Leprosy. Everyone remembers leprosy from the Bible, now called Hansen's disease. It destroys face, flesh, fingers, terrible disease. It was so rare in America that in 40 years we had perhaps 900 cases, but in the past 3 years we suddenly have 7,000 cases. We now have leprosy clinics even on Staten Island in New York, and leprosy is considered endemic to the Northeast. And where has it come from? Immigrants from India, Brazil, the Caribbean, and Mexico. How about Vibrio vulnificus? We heard about that during the terrible problems with Katrina. Vibrio is a saltwater bacterium that particularly infects the shellfish of the Gulf Coast, particularly oysters. Those among illegal aliens who use the raw delicacy of oysters as an aphrodisiac have now increased the incidence of Vibrio. And in fact, during the